Good afternoon. On behalf of the American Cancer Society, the American Cancer Society Cancer Action Network, and our health and education partners with the Show Me Brighter Future, I am proud to announce the submission of nearly 220,000 Missouri signatures to place our measure on the ballot here in Missouri. This is an important step, and it proves that we have a broad public support for a tobacco tax increase here in Missouri. With this measure, Missouri is poised to reduce smoking, improve health, and increase funding for the state's public schools, colleges, and universities. We have built a strong coalition in Missouri that includes the Campaign for Tobacco-Free Kids, the American Lung Association, the American Heart Association, and the Tobacco Free Missouri and the Healthcare Foundation of Greater Kansas City. Our coalition is growing daily, and we are building support in every corner of our state. We'll be working very hard over the next few months to educate Missouri voters and to earn their vote, and to create a brighter future for our state. I'd like to introduce Joy Sweeney, President of the Jefferson City School District, and who can talk about the positive benefits for Missouri schools.
Thank you, Misty. I am a proud supporter of this proposal, and I can tell you that we are very encouraged by the amount of support we've had to date. Today is exciting for Missouri's public school students, public schools, our local communities, and Missouri's colleges and universities. The state has struggled to find new revenue to support public education. This initiative will provide $283 million annually in new revenue to the state. Half of the revenue from the new tobacco tax would go to Missouri's elementary and secondary education classrooms. New funding for elementary and secondary education would help prevent staff reductions and increase classroom sizes. 1/3 of the new revenue would go to Missouri's colleges and universities. New funding for higher education will support educational opportunities for tomorrow's workforce and our future caregivers. It's always the right time to support Missouri schools and our children, and always the right time to improve the state's health outcomes and reduce smoking rates. I will now turn it over to Jessica Hembry from the Healthcare Foundation of Greater Kansas City to describe the positive impact this initiative will have on the state's health outcomes.
Thanks, Joy. The Healthcare Foundation of Greater Kansas City is excited to be here today in support of this initiative. We are here because Missourians are dying earlier due to preventable illnesses. Missouri has the 39th lowest life expectancy in the United States, due in large part to our high smoking rates. Tobacco tax initiatives are proven to decrease smoking rates, especially among young children. The proposed 73-cent increase would mean 33,000 adults would quit, and 40,100 children would never start smoking in the first place. This proposal would also provide much-needed funding for programs that help people quit smoking. The bottom line is this: raising the price of tobacco in Missouri will save 22,200 Missourians from a premature smoking-caused death. The future health of Missouri depends on this initiative. Tobacco use takes an enormous health and economic toll on each and every Missouri family, and this ballot initiative will go a long way to reduce that burden. And today we're excited to be joined by hundreds of thousands of Missourians in support of this initiative. Please join our effort by visiting www.showmeabrighterfuture.com. Thank you.